Okay, it looks as though we are streaming live on Facebook, so we are ready to start. I'd like to introduce the Health Commissioner for the Toledo-Lucas County Health Department, Dr. Eric Skajinski. And then we also have joining us today, Dr. Joseph Dake, who is Associate Professor or full-blown professor at the University of Toledo, and also the chair of the School of Population Health. And additionally, we do have Brandon Polinsky, who is our Quality Improvement Coordinator here at the Health Department, and also has been working tirelessly on a lot of the guidance documents we have been creating for the folks living in Lucas County. So Eric, would you like to start us out with contact tracing update with Dr. Dake? I'm not sure the direction you want to go.
I tell you what, let's, Doc, if you don't mind, do you have some time? I'd like to maybe do you last, if that's all right.
Sure.
What I'd like to do is kind of start off of where we're at in the community relative to COVID-19. I really want to stress that we still have the virus in the community. It's not like since we've been able to open up some businesses that now it's no longer there. We really want to make sure that the community understands we still need to have the social distancing, the hand washing, the making sure that if we're sick, we're staying at home. Getting tested now, we have that ability. Contacting your doctor if you are ill, and finding out what to do. These are all things that we still need to do, and probably even double down a little bit, since now we've opened things up a little bit, and we're going to continue to open things up, which is great. And I want the community to understand that public health wise, we really do need to open up the community to, again, have people start back to work and be able to, again, get a paycheck, pay for rent, de-stress a lot of issues that they have, I'm sure, in their household. But we also have to weigh that out with the virus that's in the community. So we need to walk a very fine line here relative to making sure that we can keep the virus at bay, but still have the ability to, again, bring a paycheck in, get the economy going. So we're going to be working towards that over the next several weeks to actually months, if you would. Some things that I really want to draw our attention to, again, we've already had our hotline being called relative to entities, stores, that may or may not be appropriately following the rules, and really want to stress some of these things. The big thing is, again, if you're having a large number of individuals standing outside of your facility waiting to get in, whether that's a store or something along those lines, please make sure they're social distancing. We've talked about tape on the ground, X's every 6 foot apart. Again, it's important to do these things. There's guidance documents out there for the mandatory things as well as recommended things that businesses should be doing or can be doing. Please get on our website, pull those off. It's on the Ohio Department of Health website. You got questions, give us a call. But again, we saw some things, we heard some things yesterday and already this morning that, again, we have to take as individuals in this community. We have to take responsibility upon ourselves to understand how to keep the virus at bay, as well as, again, those stores that are allowing to be opened and allowing customers in to make sure that they're doing the right things too. So I'm really want to urge the community to understand that the virus is not gone. It's still here. And if we don't do the right things, it could come back, and it could come back with a vengeance. So we don't want that. So what does that lead us to? And I'm really excited about this Friday when restaurants begin and bars begin to open back up for their patios, and kind of slowly but surely get us to the point where we can go back to some sort of normalcy with eating out and being able to socialize a little bit. But I say socialize a little bit, and that's a concern that we're having. Remember, the restaurants are going to be able to open up Friday with their patios, but we still have to have social distancing. As we go through this process, I'd like the community to understand too that we are working with the restaurant industry to look at the best practices that we possibly can have to make sure that it's not only safe for the customers, safe for the employees, but also have the ability for those restaurants to open back up and, again, start bringing some money back into the community, into the economy. Again, that is really important. Again, we're walking that tightrope again with the disease still in the community, with us trying to open things back up, and it goes again back into us as individuals making sure that we're doing the right things. I know that some of us don't want to wear face coverings, but please, when you're going out and about, wear that face covering, especially as we move back into the restaurants. That's going to be important, just not for yourself, but for the person next to you. Remember, my face mask protects you, your face mask protects mine, and we're also protecting the staff at the same time. We're reducing the ability for that virus to go from person to person, which again allows us to open up things further. Restaurants, I want to really say thank you to the restaurants. We've had some great conversations over the last couple days, specifically yesterday, and again today. They are wanting to do the right things. They are looking at options for themselves, and we're trying to help them with options to how to, again, get services back to the community, get them again to open up their business, but in a very responsible fashion. So as we work through the process here of opening up restaurants and bars to get us back to some sort of sense of normality, what we're looking at doing is asking the restaurants to help us understand too, how can we do this better? Are there things that we creatively look at to, again, allow the virus to stay at bay, but allow them to open up a little bit further, maybe a little bit faster? So I'm really excited over the next couple of weeks as we move to that May 29th date, which is really important because, again, that hopefully will now say that we no longer have to stay at home, shelter in place. We can start doing some things, but again, don't know if that's going to be lifted fully. But as we move towards that date, and again, after that date, we're still going to have to be mindful that we're doing the proper things in those restaurants and bars that limit the ability for that virus to spread from person to person. And again, I commend the restaurants and for where we're about to go and do the things that we're going to do to make sure that they have a safe environment for their staff, for the customers, and again, for our economy inside of this community. You know, I want to bring attention to public health in what we're trying to do here. For public health, it is really important for people to, again, open up the economy, because individuals who don't have the funds to be able to take care of themselves, to buy good food, will eventually cause us problems. On the other side, though, we understand that we have a responsibility to the community to, again, keep that virus at bay as much as possible. So as we walk through these next couple of weeks, we're going to have to monitor highly the community, the disease in the community, and then how each decision that we make for opening up restaurants and other entities will affect the virus in our community. So we're working together with a lot of different organizations and entities that will hopefully allow us to have a safer community and be able then to again get back to some sort of normalcy prior to the pandemic flu. The other thing that I do want to mention is that we do have the ability to do contact tracing. We've had that, and contact tracing is so important for us in the sense that this is how we can limit the spread of the disease. The faster we can get on contact tracing, the faster than the contact tracing. Let me take a step back. I apologize. The contact tracing, again, is the health department calling individuals who are positive for COVID-19. We then have to go through a history with them of where they've been, symptoms, things of that nature, so then that we can find out who they might have come in contact with and or where they were in contact with people, so that then we can reach out to them and find out what we need to do, self-quarantine, follow up with them. So you can kind of see, you know, one person, we could end up having to trace 10 other people or more because they've come in contact with them. So there's a lot of work there. You've heard a lot about contact tracing in the news. Ohio Department of Health is looking at how to improve contact tracing in the state of Ohio. We've been doing that and trying to how to improve contact tracing. We have about 30 employees on staff that have been doing contact tracing. But I think more importantly is how this community has reacted to the need for contact tracing. Early on in the pandemic flu, I contacted Dr. Dake from the University of Toledo and said, what can we do to improve contact tracing? Can you help us out? And so we sat down, put our heads together for a little while, and what we've come up with is a great process that I'd like to have Dr. Dake talk a little bit about that really adds to our ability to do contact tracing in this community. But I think more importantly, again, it goes back to Dr. Dake, the University of Toledo, and the abilities that they have to actually produce something that could either go statewide or nationally relative to the training that they put together and the processes that we're putting together. So Dr. Dake, would you mind kind of just walking through what we've come up with, and then how you've taken it from that process and then created, I think, this great product that anybody can pick up and use?
Sure. So we started off with the idea of basically creating a communication strategy for the health department and the University of Toledo so that we could use our student resources where they're learning to be able to get our students trained to be able to do the contact tracing process. So several faculty and myself put our heads together. We worked with the health commissioner and with the health department, the epidemiology staff there, and we identified what are the steps that are needed for appropriate communication, for sharing of information, of the names, to keep things where we're being HIPAA compliant, and also making sure that we're being able to bring forth all of the data that needs to be collected for the Ohio disease reporting system. So we developed a training. Originally, it was just sort of a PDF documents and Word documents. We brought in a series of public health students. Shortly thereafter, the College of Nursing jumped on board. They've been a wonderful partner with this. And then sometime after that, the physician assistant program jumped on board. So right now we have about 130 student volunteers who have been trained. They've been trained through the content learning aspect of it from what we've put together, which I'll talk about briefly in a moment. We've also had them, after their content trained, we've had them go through with faculty who have gone through the training as well to learn what the content is. And our volunteer faculty and clinical instructors in nursing will then work with the students to basically do mock interviews, to practice so that the students have a good foundation in content knowledge, in the process, in their interviewing skills, and in their thoroughness of making sure they collect all of the data that is needed. And once they are deemed acceptable to move forward, we have them join the team. Once on the team, they get assigned names as they come in from the health department. They do the interviews as they've been trained to do, collect the data and the system that we've developed, and enter that data into HIPAA compliant web forms so that that can go back to the health department for data entry into the Ohio disease reporting system. On the content training side, we have a series of modules that all of the students go through. We originally, as I stated, started it as a kind of a Word document piece because we were building it as we were doing it, because we needed the students doing the contact tracing while this was going on. But now we've actually developed this into a web-based, self-paced training module, which is comprised of learning modules around coronavirus, around COVID and its symptoms and prevention, around the contact tracing procedures. And then later modules get into the details around Northwest Ohio and what we're doing with Lucas County and Wood County with assisting those health departments in the contact tracing efforts. The Ohio Department of Health was alerted to what we were doing. They've been inquiring as we've been going along because we've been kind of on the front of this, which we've been doing well in our portion of the state. So the Ohio Department of Health asked if I'd be willing to share those modules that myself and one of my doctoral students, Jennifer Perrion, put together. And it's basically a complete web-driven going through the modules. And the Ohio Department of Health has taken the first portion of those, the ones that are not specific to Lucas and Wood counties, and they've asked if those can be shared statewide so we can support the training efforts of other contact tracers around the state. Additionally, the Association of Schools and Programs in Public Health has a nationwide database of trainings. It's called Train. They contacted me actually yesterday and asked if we would be willing to have our module that we created shared nationwide so that that could be used to support the training as well as education of students around the country. So what's great about this is first and foremost, we're able to help serve the community. But second, we have students that are in field placements or clinical experiences where they might not be able to go and get the education that they would normally be able to do in a semester. So in addition to helping the community, they're also getting clinical hours and field experience hours that are helping move them forward on the education side. So we really think this is a win-win situation. The health department, I think, has benefited a lot by the university. The university has benefited immensely by the health department. And I've gotten wonderful feedback from our public health, nursing, and physician assistant students on kind of the rewarding nature of this effort, feeling like they're able to actually take a part in helping the community work through this challenging situation that we're in. So any questions, I'm happy to answer any questions you might have.
Dr. Dake, thank you so much. I appreciate that. Again, I really felt that with all the talk about contact tracing, with the understanding that the second wave probably will be here eventually, don't quite know when, that we really need to, again, hone this process that Dr. Dake has and the University of Toledo has actually put together, and make sure that we have the ability to more than adequately respond to this community with contact tracing. The number that ODH has bannered about is about 15 contact tracers per 100,000, which gives us a little bit over 60 individuals we have to have. That to me is not enough. My goal, and talking with Dr. Dake and University of Toledo, our goal is to have a combination of over 200 individuals that we can call at any point in time to actually do contact tracing. So again, that's a big number. I don't think it's an insurmountable number with the process that I think University of Toledo is going to have in place here real soon. So this community is going to have the ability to respond effectively and efficiently when it needed to for contact tracing. So Dr. Dake and University of Toledo, they've done a great job, and thank you so much, Doc, for all the help that you've given us. And it's really important to know that University of Toledo is in our backyard, and it's such a jewel that it's helped us out so immensely over these last couple of weeks. So thank you.
No
Channing, I think we can take questions now, if there are any.
Alrighty,
Hello?
Melissa?
Hello.
Hi, Eric. You talked about having 200 contact tracers. When do you feel like you get up to that number?
I'm sorry, Mel, you broke up a little bit. What was that again?
You're talking about having about 200 contact tracers.
Yes.
When do you feel in your partnership with UT that you'd be able to get up to that number?
I definitely think that, we could be up to that number within 2 weeks. Again, the idea here is to make sure that the students are very well trained, but what we're going to do too is take that same learning module, that module that Doc was talking about, and utilize that for other volunteers or other participants for contact tracing, and use that very same training aspect. I just think that is so important, because a lot of that training that's out there right now, I think I've seen like an hour training video or process, and I know what we're looking at here is a 6-hour process. So again, I think to get our community to where I believe it deserves to be, we're going to have to go a couple steps more than ODH is asking for.
May I add a piece to that?
Please.
Just to give you additional numbers. So I think we had mentioned I have about 120, 130. That is as of right now. We currently have 100 nursing students that are being trained this week and next. So the idea of having 200, as Eric had mentioned, is certainly, I don't see that being a problem whatsoever. The thing is, at any given time, you have students that are graduating, students that are finishing. So the wonderful nature of the university side of it is we constantly have new students who are wanting to learn. So there was a local UT News story that was put to the university. An hour after that came out, I got about 15 people contacting me, asking me if they could join as a volunteer. So I think it's just a matter of how much we want to open the faucet, because we want to provide learning opportunities. But if we have 500 students that are jumping in, there's going to be many of them that aren't able to make calls for a significant period of time. And we want our contact tracers to be practiced, and we want them to have the opportunity for those skills. So I think the university has the capacity to open the spigot as much as we need to and get training in a pretty rapid manner to meet the needs of the community.
We have a question. What specific measures are you using to track the progress and effectiveness of contact tracing? And would you be willing to share those measures with the media and public on a regular basis?
I'm sorry, Doc, do you understand the question?
Yeah, and I think this is going to be really more of an epi team question. So the idea of, if I'm understanding the question correctly, is, okay, so we're doing all these contact tracing efforts. Is it actually helping? Are we being impactful by making all these calls and letting people know? I can just say generically, contact tracing has been around for well over 100 years, and this is the method that's done in infectious disease that we have to, in this case, largely rely upon people to do what is right by self-quarantining, but we need to make sure that they're able to, or they're informed that they need to self-quarantine so that they can prevent the spread, and that's really what's going on with the contact tracing. Now, to the degree that the epidemiology team is collecting other information, I honestly don't know sort of on the back end data. I know that a lot of efforts right now have really been spent on at least making sure we get that education out there. We are communicating our constituents or our people in the community about what is going on and their exposure levels. But taking it beyond that, I don't know if I have not personally done that. I don't know if the epi team has done any of that or not.
Hi, Health Commissioner. This is Amy Sagerwald with WTOL. Two questions for you. First, obviously outdoor dining is opening up on Friday. Restaurants who may not have patios to put chairs in the street or on their property, and I guess how would that be regulated?
Okay, so relative to patios, if you don't have a patio already, prior to COVID-19, if you would, you just can't say you have a patio now. That does not go with the regulations. There is some relaxing. Again, each city might be a little bit different relative to allowing individuals to increase seating capacity on their sidewalks, but not in the streets at this point in time. Specifically in the city of Toledo. Again, we still have that stay-at-home order until the 29th. Relative to patios, the patio is the patio, and the idea here is to increase that seating capacity. Would be when we're allowing people to actually open up inside of the restaurant. What we don't want is all of a sudden to, again, I'll use Dr. Dake's expression of, turning on the faucet way too fast. And we need to take some baby steps here. So the reason behind the patio is, again, to allow the restaurant to make some money, to get the processes in place, to look at social distancing, to see how that works. And then slowly but surely we'll add other things on, again, looking at the community and making sure that we're not causing undue harm. And we'll be able then to open up the inside, increase seating capacity, and then after the stay-at-home order is lifted, to see what we can do to maybe even further increase that. And the idea was bannered about can they close down streets and things of that nature. And again, those are being talked about. I'm not going to say yes or no to that right now, but again, we need to take some baby steps here. But then how do we make sure that we can open up more of the economy safely?
Okay, thank you. And then another question kind of on a different topic here on something that you guys sent out something yesterday in regards to the multi-system inflammatory syndrome that cases are popping up around the country. I know there's none here in Lucas County, but can you just talk a little bit about what that is and what we know about it?
Sure. The Kawasaki disease is what you're talking about, or this is Kawasaki. Like, we don't know enough about it yet. Actually, it was found, I think, about 1976 in Japan. And so it's been around for a while. I just want to talk real quick about what's happening right now. Is that in New York, over a week ago or so, started talking about this, and a number of children, Kawasaki disease affects usually 6-year-olds and younger. What we're thinking right now, again, the research isn't out there, so please, this is just, I don't want to say speculation, but this is just the things that we're reading research-wise, is that it could be linked to COVID-19, and this inflammatory disease, again, can cause some harm to the child. And so what we tried to do yesterday was get the message out about this, even though it's not here. We heard about it in New York. I think there are 3 cases now in Cleveland. Again, we're looking at it as a possibility of it being linked to COVID-19. The issues that we have, of course, again, if you do the reading behind it, is inflammation of the heart and vessels, if you would, that would cause some real concern to the individual and possibly could produce a fatality. So what we're looking at, again, as we put the press release yesterday from ODH and CDC. Again, could be a combination of symptoms of the child: abdominal pain, diarrhea, red eyes, rash, swollen hands and feet, difficulty breathing. So that there's a number of possible symptoms out there. I think what we'd like to do is just urge the community to, again, about symptoms and people being sick, and don't be afraid to contact your doctor. And or go to the hospital if you need to. Again, call ahead. What we're finding out, and I think nationally too, is that we're finding that people really aren't using their doctors and or the emergency rooms because they're scared of COVID. I understand that you have a life-threatening issue. You really need to seek medical help, and so I urge parents, I urge everybody, if you're having concerns, you need to call a physician or seek medical help. You do that. Again, that's the most pressing thing.
I have a question from Kate Snyder at The Blade asking about restaurants and how many restaurant inspectors does the health department have? And if we're hiring more?
Yeah, that's a great question. We'll have about 13 health inspectors that are actually going out into restaurants every year. And we got a little bit over 3,000 restaurants that we have to go inspect. The idea here is, again, we're now going to be inspecting for those typical health concerns that we always go into a restaurant for. But we're also talking with restaurants, and the idea here is that one of the things that the governor's directive is looking at is a diagram or drawing of their facility and how they're actually going to adhere to social distancing and what mechanisms that they're going to utilize to make sure that people are safe when they're in their facility. So what we're going to be doing too is asking restaurants. We don't need to send it to us. But what we're asking to do is just draw that up, post it for both customers and staff. And then when we come in, we can see it on the wall and say, okay, you have your diagram of how you're going to lay out your facility to make sure that, we're adhering to social distancing and making sure that, again, we're protecting staff and those customers. Hiring wise, at this point in time, we're okay with sanitarians and the number 4 are food services. The concern that I think we're all going to have is, again, I'm putting staff into an PPE, personal protective equipment, like a mask. So again, that's going to be important for us to make sure that we have that. The other thing then too is, glove use. I know that there was a question about glove use. Please remember, when you go into a facility, not everybody has to be wearing gloves. Actually, sometimes everybody wearing gloves could be a detriment to health and safety, if you would. So individuals are directly handling food in restaurants. Again, they know when they should be wearing gloves. Individuals that are running cash registers might be wearing gloves, or they may not. But again, those are some of the concerns that I know that was posed this morning on a question to us. So I want to make sure that got out to everybody as well. And I see a question here about Dora.
Yes, I was just getting to that. Sophia from 24 would like you to talk about the decision of
being responsible to this community on a number of different planes, both public health wise and economy. the economics involved in reopening, needing to reopen. We looked at DORA and found out that, okay, are there some things that we can do right now to, again, work on getting DORA back up to, if you would, to the status and state it was prior to the pandemic. So we're going to work on that. The idea here is, again, we don't want people going from bar to bar to bar to bar, or restaurant to restaurant to restaurant, because again, we know how this disease travels. So what we're asking the restaurants to do is, again, we're going to open up DORA. We're allowing those areas to, remember, to go out on the sidewalk once we have that capability to do that. Again, this doesn't mean that you can't have a beverage on the street, but what we're trying to do again is to make sure that we're not allowing a lot of social gatherings or people going from place to place. We really want them to stay in that general vicinity. And I think it goes forward about, well, what are we going to do maybe with streets and things of that nature? Again, we're looking at that. Again, how can we better accommodate all the issues that we have to in our community? And so that DORA will play into what are we going to do here in the near future about maybe opening up spaces for individuals.
That's, okay, this is from Dan Rutt. A couple of weeks ago, you announced that up to 3,000 tests would be available to test long-term care facility staff and residents in Lucas County. What proportion of staff and residents have been tested since then?
Actually, that was a 6,000 tests that we brought in, and probably a number of long-term care facilities have already taken advantage of that. The tests are coming back again a little bit slower than we wanted to, just because I think the logistics and having to sign up and things of that nature. But again, those long-term care facilities in that program are there's a number of long-term care facilities that already tested their residents and their staff, so they didn't need to be on that list. Again, this was a strong recommendation to those long-term care facilities to participate, and well over half of them have already done that. So again, that is good. The idea here too is that there is other testing in the community now, which is fantastic. Rite Aid, Walmart, Kroger's have been better off we're going to be able to get a handle on some things that are going on in certain segments of our population. Then, of course, we'll be talking about antibody testing here in the future, about what that means for different segments of our population and our community. We really need to figure out what is our percentage of, if you would, herd immunity. How many people actually have antibody to this virus? And I think that's going to be important for us to really understand coming that second wave. Again, it's going to help us out a little bit with resources, as well as an understanding of disease in our community.
Okay, last question. People who are incarcerated may very well be the highest risk for infection. How much testing is being conducted among the prisoners and staff, and what measures are being taken to prevent infections among that group of individuals?
Statewide, and I don't know if our prison has had this done yet or not, but I know that the state is going to test those populations. Locally here, the sheriff has done a really good job in the jail itself. Again, testing is being done, follow-up is being done. They're adhering to the procedures and protocols for quarantine and isolation of individuals. So again, the idea here is not only the jail population, but there's many populations in our community which, again, we're attempting to get into, whether that's the long-term care facilities, the jails, those the homeless, the underserved. I mean, there's so many different populations that we really need to better understand what's happening in those populations with COVID, but then also helping them out. So unfortunately, the help really should have come months ago with better testing, more testing, but we just didn't have that. And so we're going to have to really sit back and figure out what was done right, but more importantly, how can we improve on some things that weren't much like. So again, we still have to combat the COVID as it is right now, with the hope that eventually it's going to die out a little bit, but with the understanding that we are going to have to come back around at some point in time and attack COVID again.
Right, I think that's it for questions.
Great. Thank you so very much, everybody. Dr. Dake, thank you so much. Brandon, thank you so much for being on.